Hey guys, if you're not able to watch my long form content of podcast, here are some short form clips for you to enjoy. How to overcome vitamin deficiencies in vegetarian. In America, do you see a lot of vegetarians?
Huge.
Lot of our Indians are vegetarian,
Huge,
right?
yeah.
And
No, not Indians, American people.
they're also
They're
deficient.
Yeah, it becoming like a fashionable statement.
So what's it like? I would love to be the fly on the wall in your consultation room. Somebody comes in like, "Hey doc, I'm vegan, I'm vegetarian," and then you're looking at them and you're like, "What are you looking for?" Are you looking at the blood test, or you're looking at anything from their body? How does it work? How does your brain work or mind work with such people walking in?
When they say they're vegetarian,
Like how are you clinically diagnosing people?
um,
Like for example, somebody walks in, can you say that they're vegetarian or vegan? Very difficult.
no,
But the moment they tell you that, then
but actually, I can say based on looking at the stomach and colon, I can guess, educated guess. So I've seen,
and you see vitamin deficiencies from that?
no, vitamin deficiency. We're talking about B12 deficiency,
Correct.
as you know, long term. That is not a huge problem because even if you are deficient in B12, supplementation takes care of the problem. So that is not a huge thing. What I was trying to say was gut bacteria loves vegetarian food more than non-vegetarian food. That is kind of proven on basic science research and also clinical research as well. So when we do the endoscopy, camera going to the stomach, we see, I personally feel like the stomach is less angry. And I ask them, are you, after the procedure, I ask them, are you vegetarian? They'll say yes. Same thing, if I do a colonoscopy, I don't see any polyps at all. And then that patient will be a 65-year-old Caucasian man. How come you are not having a polyp? You eat, your diet is like processed meat and everything. He said, no, I'm a vegetarian.
So I'm going to throw a little bit of controversy into the pot. There are doctors out there in the West, for the Western Caucasian population, that are recommending only a meat diet.
Yeah, carnivore diet.
The carnivore diet. Right? So you've heard about this carnivore diet?
Yeah.
Have you seen carnivores come in and do the endoscopy and you're seeing disaster inside of them?
A lot of polyps.
But have you also seen, like the vegetarian, a clear gut? Is it bio-individual also for people?
Yes, absolutely. It is bio-individual. But the probability is lower in a vegetarian diet. But doesn't mean that meat is wrong. What I'm trying to say is, our gut bacteria loves fiber, and fiber is in vegetarian food. If you're having non-vegetarian, make sure that you have lots of fiber as well. I'm going to be having my steak with a lot of broccoli, cucumber, and zucchini. So that's what I want to be doing. Yeah. So one thing I want to tell you is, I always tell my patients, don't choose vegetarian or don't choose non-vegetarian. Be Dr. Palitarian.
What's that? Dr. Palitarian.
Dr. Palitarian is, 3 meals a day.
Yeah.
7 days a week.
Yeah.
21 meals a week.
Yes.
And out of this 21, 80% vegetarian. So 15, 16 meals is vegetarian. The remaining 4 meals, you go non-vegetarian and you can eat whatever you want. If you're eating red meat, limit to 500 grams per week.
That's a nice one I've never heard before. Limit non-vegetarian to 500 grams.
No, red meat.
Red meat.
To 500 grams per week if possible. Correct.
Nice one. One common problem in gastric issues we are seeing is that more and more of the teenagers, more and more of the working individuals are complaining of gastric problems. And we're talking about an age group of 15 to 30. But you're seeing a lot of older people. So is there something that you're seeing in your practice where more youngsters are coming in with gastric problems?
So when a patient walks in, there are only 2 age groups that walks into my patient office. One is 60, 65. The other one is 20, 30.
So the 20-30s are walking in because
of abdominal pain, cramps, bloating. This food is not adapting to my gut. What should I do? And the first question that I ask is, what are you doing in terms of your profession? And most of the times, especially in India, when I see patients, they work for a foreign company in US. And they work night shift. And they work from 10 p.m. to 6 a.m. where
the graveyard shift.
Because it's in US, it's the morning time. Correct? And again, you're disturbing a circadian rhythm. The first thing that goes wrong when you're disturbing a circadian rhythm is gut. And that's where they say, go with your gut.
I'm going to go a little Star Trek on our podcast. The gut microbiome. I read a study somewhere that they have started fecal bank transplants. Can you talk to us about what is this fecal bank transplant, and is it true that when they take the donor fecal and put it into a bad person, there have been incidences of improvement of the gut health?
Yes, we do. We do fecal transplantation for a disease called C. difficile colitis,
Okay.
where it is a bacteria that comes into the body and affects the colon and makes the colon looks very inflamed and angry. And no matter what medication that we give, we will not be able to.
Is it true C. difficile thrives in a non-veg environment, non-vegetarian diet?
No. I mean,
So
I don't know.
why does this bad guy come into the body?
Oh, because of, antibiotic exposure. So we do lots of antibiotics, and whenever the risk factor is multiple antibiotic exposure, then you'll see difficile gets.
So we see this in children?
Yes, but not that common.
Not that common.
Adult, big time.
So an athlete one day came to me and says, "Sir, can I do fecal transplant? Because I heard that a faster athlete has better bacteria. So can I get his poop into me?" So is there any logic to this? Do you see medical science going in that direction?
I think 5 years from now, we'll be talking some kind of sense, but not right now.
Okay.
But multiple research are going in that field though, but nothing concrete. But it is true in mice when you transplant a bad bacteria into a good gut bacteria, the mice will have behavioral problems, will have anxiety issues. That'll be translated into clinical practice. That's what people are doing right now.
So is it true that before our body digests food, the bacteria in our gut, the microbiome, actually first eats the food?
No, that's not true. Because when you're eating, it goes in the stomach. The stomach acid digests the food and then gets into the small intestine, and we get the first bite. Small intestine has all these enzymes, like pancreas secretes enzyme digesting fats. Stomach also secrete digesting proteins and carbs. All these are getting digested in your small intestine. And after everything is done, only the roughage goes into the colon. And that roughage should have fiber to feed the bacteria in the colon. So they get the second bite. But we need to make sure that we feed them as well.
Interesting. This is my question. It's a funny question. How much of farting defines you to be a farter or not a farter? Is there a medical benchmark? Because people come to me and says, "I got a lot of gas." So I ask them, "Have you farted in my chamber right now?" So they say, "No." I'm like, "You don't have a gas problem." So how do we advise people? Because people have different senses of laughter, different senses of I am strong, you're strong, I am not strong. So from a farting perspective, gas production, burping and farting, what do you think is a sense of a barometer?
So I think it is again individualized. It's based on, how frequent it is. And then key thing is, what are the other GI problems that you are having? Let's say you are having constipation, you are having bloating, then that flatulence is a significant problem.
Interesting. So what I do is I tell a person, eat a certain food and tell me 3 to 4 hours later, are you creating more gas?
That's true. The first treatment that we do when patients come with flatulence is food diary. So you document everything what you eat.
And when is the most amount of gas production? If Tesla could only run on human gas, we would have indigenous vehicles.
And the patients will ask me, sir, is it has to be a written format or you want a video format? I said, no. Written format is okay.
I was about to ask you, is there audio included in that? Like, what level of velocity of noise are you creating? So much of volume of gas, so much of decibels. But jokes apart, as people get older, right? As I have gotten old and I'm moving towards my 50s, I've noticed in certain foods on certain days that I eat, I will produce more gas. I will fart more. And sometimes it's embarrassing because you try to get the silent fart and, it's the noisy fart. That's also still good. But then you get the smelly fart. As a gastro doctor, are we looking for anything which can tell us that you need to change your diet or change your health in the gas department?
So whenever the flatulence is bothering, whenever it is compromising the quality of life. So for example, I've seen many patients, I'm in the meeting and, I need to run to the restroom to have the gas released. And it is happening very repeatedly. And that's where the problem is, right? And then invariably, as we talked about, most of the times it is a lack of balance between a good and bad gut bacteria.
Hey guys, if you've enjoyed this clip, then click here and watch the full episode. And don't forget to subscribe because your body is the most expensive real estate and I'm your real estate agent.